Welcome to Cutting Edge.
My name is Joe Lundgren. My wife and I own Cutting Edge Pediatric Therapy in Allen, Texas. We have a little bit different model of things that I'll explain to you a little bit about, but I'll leave the medical portion more to my wife, who is the expert in that area. We are parents of two autistic children, Trenton and Spencer. Both are young adults at this point in time. And when we created Cutting Edge Pediatric Therapy, we not only wanted to create an environment where our clients, the children and young adults who come here, got the best of care and, no pun intended, the most cutting edge treatments. We also wanted to create an environment where the families could come and find peace. I used to tease my wife on a consistent basis and tell her, you were not a soccer mom, you were a therapy mom. And those moms out there that drive from therapy to therapy to therapy know exactly what I'm talking about. So when you come to Cutting Edge Pediatric Therapy, we've created a waiting room that is something that's inviting, it's relaxing. You can come and have a nice gourmet coffee or a soda or water, help yourself to snacks. There's charging stations, it's Wi-Fi, there's computer cards. Soon to be coming is also our relaxation room with a massage chair that will be something that I'm sure the moms will really enjoy to be able to have that time. But also my wife and I really want to be able to focus on the family, because we know how difficult it is. And when I say focus on the family, it's really an environment that we want to keep our door open to you as parents. We want you to be able to pick up the phone, call us, ask any kind of question, not even necessarily about occupational therapy, but about anything that you're going through with your child, whether it has to do with the school district, or whether it has to do with guardianship, or whether it has to do with SSI, whatever it is that you're trying to figure out. My wife and I have probably gone through it. And we don't have all the answers, but we can direct you to the people that do. And so our key here at Cutting Edge is not only providing that service to your children and young adults who need that service, but also giving you the peace that you need to have to know that your children will be taken care of for the rest of their lives.
Welcome to our treatment gyms. Here at Cutting Edge, we try to make the environment therapeutic, but it also needs to be a little bit fun, because our occupation in occupational therapy is play. So we have all of the state-of-the-art equipment here, including swings, and we have slides, we have rock climbing walls, you name it, everything to make this environment therapeutic, but also to make it fun for your kiddos. Because what we know is kids are not going to want to work on something that's not fun. So our therapists have been trained to make the attainment of goals a process that's therapeutic but fun at the same time.
Here at Cutting Edge, you'll find that we have 3 large gyms, and what this allows us to do is be able to ensure that your child, who is our priority, is getting the treatment that they need so that they can be separated from other activities going on in the facility. And you'll see that in the gym, we've got a lot of what I'll call playthings, but dads are usually the ones who are optimistic about this, and so I'll talk to the dads here. And that is where we can make a difference with these type of equipment. As your kids come in here, they think they're getting play, when in reality it is a therapeutic intervention that allows them to do other things. Sure, we're not working on tying shoes or batting at baseball right here. All of this adds to their coordination. So that is a big thing to keep in mind as you look at our facility, and we have this big facility with the 3 separate gyms. That's exactly what we're trying to do, is create an environment where your child can move forward.
Part of our mission at Cutting Edge is to make sure that we're providing things for the community. And one of those is we are a teaching facility, and as a previous adjunct and a guest lecturer for Texas Women's University, we at Cutting Edge have had the opportunity to provide clinical experience for the up-and-coming occupational therapists in the area. Not only that, we have a very large volunteer network, and we've allowed our volunteers that are interested in pursuing working with special needs to do volunteer hours here to make a choice whether this is the field of their choice and their passion. The other thing that you'll see here is we have a very large testing area. And we are able to do testing in 2 different modes. We can do testing in a large area like this room where it's all encompassing and you are able to view this from out of the area and your child is not distracted. The other thing we do is we have a very small testing room, and this testing room is more isolated, and it'll provide an isolated approach for a child that needs that type of testing. What we really like at Cutting Edge is that we are able to accommodate the particular needs of the client rather than the client having to adjust to the treatment facility, which we often find. We have created Cutting Edge to be a state-of-the-art facility that will meet the needs of every child. I was the parent that sat in many of those therapy rooms and many of those waiting rooms, and I was the parent frustrated with the lack of coordination of care that occurs often with our kiddos. What we've tried to do here at Cutting Edge is be able to narrow that gap and provide an environment where you can get all your needs met here. Our therapists have been trained specifically and specialized in certain areas of intervention. Our testing is state-of-the-art. Our treatment plans are individualized, and our wonderful therapy dog is very loving, which is most important. Welcome to Cutting Edge.